Tonight on PBS News Weekend, a new study highlights how bias affects the detection and treatment of some types of cancer in the LGBTQ community. Then a look inside the world of domestic workers and their lack of basic labor protections. And as the spring bird migration season draws to a close, the death toll of birds crashing into windows and what groups in one American city are doing about it.
Folks don't recognize just how serious of a threat this is because it's such a passive threat. This is simply by us existing in the way that we live, having windows. It's a threat to birds and it's killing birds.
Major funding for PBS News Weekend has been provided by and with the ongoing support of these individuals and institutions. And friends of the NewsHour. This program was made possible by the Corporation for Public Broadcasting and by contributions to your PBS station from viewers like you. Thank you.
Good evening, I'm John Yang. More than 90 nations, including the United States, are making a show of support for Ukraine at a two-day peace summit in Switzerland. Ukraine hopes the United Front will strengthen its negotiating position with Russia, which pointedly was not invited to the gathering at a resort in the Alps. Vice President Kamala Harris is representing the United States. She announced a $1.5 billion aid package aimed at Ukraine's hard-hit energy sector. Meeting with Harris, Ukrainian President Volodymyr Zelensky looked forward to a post-war Ukraine.
We are here today for the sake of diplomacy, and Ukraine has always believed in the power of diplomacy. War is not our choice, it's Putin's choice.
National Security Advisor Jake Sullivan called a proposed Russian deal to end the war a completely absurd vision. The Israeli military says 8 soldiers died in an explosion in southern Gaza today, the second deadliest attack on Israeli forces of the war. In Gaza, families are preparing for a bleak Eid al-Adha tomorrow, one of the most important festivals in the Muslim calendar. It's usually celebrated with big family meals and gifts for children. But this year, there's only war, hunger, and misery. The holiday marks the end of the Hajj, which peaked today with nearly 2 million Muslims gathering on a sacred hill in Saudi Arabia for a day of worship. The Hill of Mercy is believed to be the site of the Prophet Muhammad's final speech, known as the Farewell Sermon. Across France, hundreds of thousands of people turned out to protest against a far-right political party in advance of French parliamentary elections. Labor unions, students, and groups fighting racism called for the protests after the right-wing National Rally Party trounced President Emmanuel Macron's centrist party in last week's European parliamentary elections. The first round of snap French parliamentary elections will be held at the end of the month. And Kate, the Princess of Wales, made her first public appearance today since she said she's being treated for cancer. It was at festivities to mark the official birthday celebration for King Charles III, who himself was treated for cancer in January. Kate said in a statement yesterday that she's not out of the woods yet and will continue chemotherapy for a few more months. Still to come on PBS News Weekend, why U.S. domestic workers have fewer workplace protections than other employees, and how the city of Philadelphia is working to protect birds from deadly window collisions.
This is PBS News Weekend from WETA Studios in Washington, home of the PBS NewsHour, weeknights on PBS.
A first-of-its-kind report from the American Cancer Society is shedding new light on cancer risks for LGBTQ people. It finds that some LGBTQ populations are more likely to have cancer risk factors like smoking, heavy alcohol use, or excess body weight. Transgender people are less likely to be screened for cervical, colorectal, and prostate cancer. And LGBTQ people continue to face barriers to high-quality health care, including discrimination. Dr. William Dayhut is the American Cancer Society's Chief Scientific Officer. Dr. Dayhut, this is the first time this is being done. This is being looked into. Why now? Why did you decide to do this now?
Well, thanks very much for having me on today. It's really a great question. It's really important to know that this was really a way for us to get a clue to the cancer risk to this population. Cancer communities, cancer registries do not collect data for cancer deaths, cancer incidents based on sexual orientation or gender. So I think this is really important to begin to understand, is the risk different? So we begin to capture that information in a much more critical way.
Were there things in your findings that surprised you? And what do you think are the key takeaways from this report?
Yeah, a couple of things are really important. I think, first of all, you really need to disaggregate the data by the population. This isn't really one homogeneous group. So certain groups, I think, as you commented on early on, looking at bisexual women in their 40s and 50s, much higher alcohol use, obesity use, tobacco use. These are real risk factors for cancers. Other things were also interesting. Overall, the vaccination rates were actually fairly similar to other populations, the cisgender populations. I think that was good news. Screening rates are fairly good, except, as you mentioned, in transgender men, where there's much fewer screenings done for colorectal cancer and transgender men with the cervix or cervical cancer and prostate cancer. So there's a lot of variety, I think.
The risk factors, are these directly related to being gay or lesbian or transgender, or is it also part of because of the stress that comes along with the stigma of being in those communities?
Well, the risk factors themselves are really risk factors for anybody to have cancer. Our data, there's about 40 to 42% of cancers are actually preventable. And probably the risk of dying from cancer is actually the risk prevention. It's probably easier to prevent dying from cancer by changing behavior. And so we focused on those behaviors, alcohol use, obesity, tobacco use. And we did see them higher in population, particularly in the bisexual women. And so that gives us concern that there'll be a higher risk of cancer rates and deaths. And then if folks are not seeking medical care because of biases, then there's likelihood that people will present with even more advanced disease and have poor outcomes.
You mentioned biases. How much of this has to do with the culture of maybe society or medical care? There was along with this report, there was a study came out from Dana-Farber Cancer Institute that said 80% of LGBTQ cancer patients they surveyed said they didn't get appropriate preventative screening. 34% said their partners felt welcome in the part of their treatment, and only 4% of the partners said they felt respected by caregivers.
Yeah, it really is concerning. There was one fact that the paper pointed out that only about 25% of current medical students actually feel comfortable in taking care of transgender individuals. And 30%, there was really a sense of potential perceived bias, actually, when you thought about it. So I think seeing this hesitancy to seek medical care for real and perceived bias can actually lead to much poorer outcome. Even if you're screened on time, if you have symptoms, if you're not seen for your symptoms, you're much more likely to present with more advanced disease. So there clearly are personal concerns by people from this community.
What lessons can be learned from this, and what things can be done to overcome these problems?
Well, I think number one, the first lesson is I think we need more data. We need data actually on true cancer incidence and mortality in the LGBTQ population. So I think that's important. And secondly, the same things that are likely to drive risk for all folks, we need to focus in on this population too. Ensuring people have a normal, healthy weight, exercise, don't smoke, and decrease alcohol use. And then really begin to educate our students, our interns, our residents, that's really to have a much more inclusive, welcoming attitude. Because if we actually push people away, the outcomes, particularly in cancer, could really be devastating.
Dr. William Dayhut of the American Cancer Society, thank you very much.
Yeah, thanks so much for having me.
In many American households, domestic workers like nannies, housekeepers, and home health aides perform essential tasks. But as Ali Rogan reports, they also have fewer rights and protections than most U.S. workers.
Each day, nearly 2.5 million nannies, aides for the elderly, and home cleaners do jobs that allow much of the rest of the American workforce to do theirs. But despite being such a foundational part of the economy, many of these workers are excluded from key workplace protections. Those include the Fair Labor Standards Act and the Occupational Safety and Health Act, which respectively cover wages and workplace safety. Protections also vary by state. 11 states and the District of Columbia have passed their own domestic workers' bills of rights, but there is no such federal law. Members of Congress have tried and failed to pass a federal version for several years. Caitlin Henderson is a senior researcher at Oxfam, a global organization fighting poverty and injustice, where she studies how states treat workers and working families. Caitlin, thank you so much for being here. First of all, why have domestic workers historically been excluded from these sorts of protections?
So unfortunately, that reflects a long history of sexual and racial discrimination in this country, where Black women were really excluded from labor protections in the 1930s during President Franklin Roosevelt's New Deal. Unfortunately, when we were creating the social safety net that still exists today, a lot of Southern senators were very nervous about including Black workers in frameworks of minimum wages, overtime protections, and the right to organize.
And beyond their exclusion from these statutory protections, why is it that these workers are so vulnerable to mistreatment?
As you mentioned earlier, domestic workers are excluded from the Occupational Safety and Health Act, which means that a lot of protections most workers have for their workplace does not extend to domestic workers, because usually that means people's homes. So they're very exposed to issues of discrimination and harassment. Domestic workers are also not included in the Civil Rights Act from the 1960s. So they're uniquely exposed to types of vulnerabilities most workers don't have. The majority of domestic workers in the United States are women, women of color, and especially immigrants. And as another collective of workers that has also been excluded from the National Labor Relations Act, which establishes the right to unionize, a lot of these workers feel uniquely exposed and vulnerable and not as comfortable bringing up issues to their employer, especially since they are very classically at will, and their employers, which is again often families, individuals, can terminate their employment at any time.
As you mentioned, there are efforts to correct these issues. What is happening on the federal level?
So we have in front of Congress today a bill that's called the Domestic Workers Bill of Rights, which is a very exciting piece of legislation. As you mentioned, a similar piece of legislation has passed in 11 states and DC and Puerto Rico and several cities. So we know that it works really well. This would be a piece of legislation that establishes minimum wage provisions, overtime protection, protection at work from harmful chemicals, for example, protection against discrimination and harassment, and the ability to collectively organize.
There have been efforts for several years now to pass this Bill of Rights. Why does it keep getting stalled, apparently?
We're waiting for the political will from a lot of individuals to see the value in this. We know, as you mentioned, domestic workers are the workers that let all other work happen. So these are intrinsically valuable, absolutely essential workers to our economy. Hopefully people will change their minds and realize the importance of this sooner than later.
Another piece of this seems to be making sure that workers know their rights. Why is it such a challenge to reach these workers where they are and close that awareness gap?
It's so hard when your workplace is someone's home and you work by yourself. One of the best ways to organize workers is when you find them in a collective, and domestic workers usually work alone or in a vacuum. So it's taken a lot of time for the National Domestic Workers Alliance, among other organizations, to reach out, build community, and collectively organize these workers.
What sort of mistreatment typically happens to this segment of the workforce?
Because they're working alone at the house, often they are extremely exposed to issues of sexual harassment, discrimination, exposure to chemicals in the cleaning products, as an example. There's also a tendency to not pay workers if they are canceled upon, if their shift is canceled at the last minute. So it's hard for these workers to have a plan in terms of if they have their own caregiving responsibilities.
How did the COVID pandemic affect the domestic workplace? COVID
was a huge problem, especially since we were all told to go home, shelter at home, and that's usually the workplace for domestic workers. So it was an incredibly economically vulnerable moment for domestic workers that we're still trying to solve for today.
It seems contradictory that a part of the workforce that is so foundational to the American economy is also treated as part of the periphery. Does that perception need to change? And if so, how does that happen?
Absolutely. Care work really is the work that makes all other work possible. And I think the COVID-19 pandemic did an important thing in terms of allowing all of us to recognize how crucial care work is, whether it's child care, elder care, care for people with disabilities, or domestic work.
That's Caitlin Henderson with Oxfam. Thank you so much for being here.
Thank you.
Every year in the United States, as many as 1 billion birds die while migrating. It's not due to climate change or some toxic substance in the air or water. This culprit is hiding in plain sight. The birds are killed when they collide with glass. For the latest in our Saving Species series, we went to see an effort to reduce this carnage in Philadelphia, where it turns out residents love a lot more birds than just the eagles.
And so the birds are attracted to the brightness.
The sun is barely up over downtown Philadelphia, and the guy known as the Birdman is already at work. Stephen Maciejewski is a fixture here during the spring and fall migrations, looking for birds not in the skies, but on the sidewalks where they've fallen after hitting a window. Some are dead, some are injured, others just stunned.
They don't know what glass is. They don't know glass is hard. They just see a reflection, or they think they can go in or through, and then they start hitting.
It didn't take long for Maciejewski's eagle eyes to spot a dead ovenbird, a small songbird.
So beautiful. They have this orange crown, and they have this loud voice singing, "Teacher, teacher, teacher."
The species and other details go into his logbook. The dead bird goes into a plastic bag to be taken to a lab for study. The all-too-common routine done, he moves on. Maciejewski's a volunteer for Bird Safe Philly, a partnership aimed at creating safe spaces for birds. Since 1970, the United States and Canada have seen a decline in bird species of 30%. While much of it's due to habitat loss, glass windows pose the third largest threat. Robin Irizarry is with Audubon Mid-Atlantic.
Folks don't recognize just how serious of a threat this is because it's such a passive threat. It's not something that we're actively doing, like engaging in deforestation or, paving over areas of habitat. This is simply by us existing in the way that we live, having windows. It's a threat to birds, and it's killing birds.
Sort of organized how we classify birds. So
Jason Weckstein runs a lab studying birds at the Academy of Natural Sciences of Drexel University.
And you can see this is filled with specimens that say Philadelphia.
Its collection of birds killed in window strikes dates back nearly 150 years.
If you look here, there's specimens from 1877.
Wow.
This one from 1906 is actually from the early window kills that happened here in Philadelphia. So this was on City Hall. When City Hall was first lit up, we actually had window strikes happening there. There were some window strikes just from glass alone. That does happen. And certainly glass on its own is a problem when it's reflective, but you add lights into the mix and it makes it a lot worse.
Birds make their long migratory journeys mostly at night, and for reasons still not fully understood, they're drawn to artificial lights. Philadelphia sits on a migratory superhighway known as the Atlantic Flyway, so its brightly lit skyline is ripe for the sort of mass collision that occurred on October 2nd, 2020.
We had around 450 birds just at this building. And I'd take care of like a number of birds, I'd process them, and people say there's more down there and more down there.
How many birds did you collect that day?
800 or 900.
Wow.
And we kind of thought that there was probably over 1,500 that were killed.
That happened essentially in my backyard. I live in that area.
That catastrophic event moved bird lover Marianne Scott to action.
There is a general misconception that it's the high-rises that are the biggest problem. So, the statistic, I think, is that it's 4 stories or less where the most fatal collisions occur.
As executive director of the Building Industry Association of Philadelphia, she's working to convince the members of that residential real estate trade group to turn off lights, both inside and outside, between midnight and 6 a.m. during migration seasons.
I think by and large people don't know that there's a problem. They're shocked to hear when I say there might be 300 million birds traveling across the country now.
In fact, the night before we went on patrol with Stephen Maciejewski, an estimated 660 million birds were in the skies over the United States in the midst of their spring migration north. That makes for a busy morning. An injured ovenbird is placed in a paper bag for transport to the Schuylkill Wildlife Center's clinic for rehabilitation. Then Maciejewski helps an apparently stunned bird struggling to regain its sense of direction and get on its way. Next, an injured yellow-throated warbler. And at the entrance of an office building, a box safeguarding the body of a dead bird left by building staff who've gotten to know Maciejewski.
I actually have him in my contacts on my phone because this is so sadly regular occurrence. There's been times when I've been sitting there and they've flown in, to the window.
Really all the building staff, whether it's security or janitorial predominantly, who used to just clean up and move on. Now we're trying to save as many as possible.
Building manager Don Haas is a key leader in the Building Owners and Managers Association of Philadelphia, or BOMA. He's working to get his counterparts on board.
We're controlling all the outside lighting and the crown lighting, lobby lighting, so we encouraged all of our BOMA members to sign on to the Bird Safe Lights Out Philly program. We had a terrific response. I think we're probably at 60 buildings.
Some cities and states require bird-safe design. In Maryland, state law says buildings that are at least 50% publicly funded must follow bird-safe design practices. A New York City law mandates that all city-owned buildings turn off lights at night during migration season. In Canada, Toronto requires new and existing buildings to take steps to be bird-friendly. In West Philadelphia, the University of Pennsylvania makes being feather-friendly part of its sustainability plan. Many school buildings take part in Lights Out Philly, and in some, like the Sing Center for Nanotechnology, window glass is etched with vertical stripes, a pattern that's been found to reduce collisions. It's the same idea as the dots on the transparent film covering the windows of Lauder College House, one of the campus dorms.
I've sort of become the bird expert in my friend group. I receive texts where friends will say, I heard this bird at this late hour of night, is this normal?
Student eco rep Zaid Doman monitors the campus for bird strikes as part of his work-study program.
There have been birds I've picked up right after they were hit, and most of them were dead, so I can feel the sort of remnants of life leave their body, and it is really hard, and it's not something that gets any easier. To me, it's always struck me as this sort of microcosm of how humans interact with the environment in general. It's our architecture, it's our human influence on the environment around us that is causing these birds to get hurt and to die.
It's an idea that helps inform the work of university landscape planner Chloe Cerwinka.
The way I got interested in birds was through trying to find another way to understand whether our landscapes were functioning. Because if we're inviting these birds in by creating these important habitats that they need, then we absolutely have to make sure that it's a safe space for them. We can't invite them in just to let them die in the built environment.
The solutions Penn is employing are just some of the methods found to be effective. At the Discovery Center in Philadelphia, Robin Irizarry shows us others.
These are Acopian bird-saving blinds. These are a simple technique, a really cost-effective technique. And this is just a network of paracord that protects birds from flying into the glass here. You want to have a distance of about 4 inches. So when a bird's flying through there, it's not going to feel comfortable going through that space.
I like they call me Birdman. It's an honor.
Back on the streets of Philadelphia, Stephen Maciejewski wraps up his day. He's collected 13 dead and injured birds. The injured were sent to rehabilitation. The dead were neatly placed in a freezer at the Academy of Natural Sciences alongside other birds that have met similar fates, all available to be used for research.
It's very sad to find these birds. I mean, they're coming up north looking to raise a family, traveling like thousands of miles from South America, Central America, the Caribbean, to come this far and then to die on the streets of Philadelphia.
Now online, educators in Missouri worry that a new bill promising salary increases doesn't guarantee them. All that and more is on our website, pbs.org/newshour. And that is PBS News Weekend for this Saturday. On Sunday, Nick Schifrin sits down with National Security Advisor Jake Sullivan at the Ukrainian Peace Conference. I'm John Yang. For all of my colleagues, thanks for joining us. See you tomorrow.
Major funding for PBS News Weekend has been provided by
Consumer Cellular. This is Sam. How may I help you? This is a pocket dial. Well, somebody's pocket. Thought I'd let you know that with Consumer Cellular, you get nationwide coverage with no contract. That's kind of our thing. Have a nice day.
and with the ongoing support of these individuals and institutions. This program was made possible by the Corporation for Public Broadcasting and by contributions to your PBS station from viewers like you. Thank you.
You're watching PBS.